It's the largest healthcare organization in the Mid-South, Baptist Memorial Healthcare. With 15,000 employees, 14 hospitals in 3 states, and hundreds of healthcare clinics and providers, community outreach, and more. On today's Health Matters show, we're talking to the new CEO and face of Baptist Memorial Hospital, Jason Little. Thank you, Jason, for being here today.
Thank you for having me, Dr. Castellaw.
Now, tell me about your new role at Baptist.
Well, it's a real privilege and an honor. As you said, getting to represent 15,000 employees and carry out our mission, which mirrors the threefold ministry of Christ of healing, preaching, and teaching, and really following in the footsteps of a guy who's have really big shoes to fill. That's Steve Reynolds. For 43 years, he worked for Baptist, and for 20 of those years led our organization as CEO. I become the 5th CEO of Baptist in 102 years, so it's an important heritage and inheritance that I get to take over.
Well, Jason, I know, speaking on behalf of the other physicians at Baptist, we're really, really glad that you've taken this position. You have the utmost respect in the medical community, and we really look forward to working with you.
Well, that means a lot to me. I appreciate it. I'm honored to serve.
Jason, what's going on at Baptist right now with all the changes in administration and people? What are some of the things that you'd like to talk about?
Well, Dr. Castellaw, we've got a great team. We have some new faces and then some faces that have been around our organization for a long time that are taking on new roles. One, our new Chief Operating Officer. It's the first time ever in Baptist history where we've had a physician as a Chief Operating Officer. The person charged with running the day-to-day operations of our hospitals, Dr. Paul DePriest, who was our Chief Medical Officer, came to us from the University of Kentucky, did his business training at Harvard, is now stepping into this role. We're really excited about that. We have a new Vice President for Government Affairs. You know, now more than ever, larger percentages of our payers, of our insurance companies, are government payers.
You mean the government has something to do with health care?
Just a little bit.
When did that happen?
Just a little bit. We woke up one night.
I woke up, okay, go ahead.
But Keith Norman, Reverend Keith Norman, who pastors First Baptist Abroad Church, is, in addition to serving in the pulpit on Sundays, now coming in as work for Baptist in a new position for us as Vice President for Government Affairs.
Well, great. Today's show, our emphasis is really about pediatrics. So how has Baptist helped the pediatric market, and what is Baptist doing in that area?
Well, we're growing in this area. It's an extremely important area to our organization. And you know, for a number of years, the place that most women trust with their care is the Baptist Women's Hospital, the only hospital dedicated to women in the region. Deliver 5,000 babies there every year, and we're expanding that. We're building a new children's hospital right there on that campus to take care of kids now from birth all the way through adolescence, so that all families can trust their care to Baptist.
Well, what are some other ways that Baptist is growing to help the healthcare needs in our community?
Well, we've got a number of new facilities coming up. It's not all about facilities, but we're proud of the new ones that we're bringing online. We have a new rehabilitation hospital. We are about to start construction of a new behavioral health hospital. You know, those with mental illness are some of the most underserved in our community, and so we're looking forward to adding that into our product offerings as well. So a lot going on at Baptist.
One of my main area in primary care, what's Baptist doing with primary care right now and minor meds and things like that?
Well, we're expanding again. I mean, our goal is to be the integrator of healthcare. When you need something, you just call on the Baptist name and we'll be there as a trusted reputation and provider of that care. And so access points are extremely important. As an example, just down on Union Avenue, we've just opened a new flagship primary care clinic.
It's a beautiful facility. If you haven't been down there, you need to go down there, whether if you're sick or not, and check it out. It's a beautiful facility.
Yeah, well, it was the old post office, and so a lot of renovations added to that. It's an urgent care where you can just walk in, or you can have an appointment to see the great physicians that are down there. And so really expanding those access points through urgent care, minor med, wherever you need us, we want to be there when you need us.
What do you see as some of the future for Baptist?
Well, I think, again, as healthcare kind of becomes global almost, you can pull up on your iPhone now all kinds of apps to help you take care of health. And so informatics is becoming an increasingly important part of our entire service offering. And so we've spent about $300 million on a state-of-the-art electronic medical record to put information not only at the fingertips of the physicians and the providers, but also the patient. So you can, from anywhere, go online, download your immunization records for your kids, or upload blood pressure information, and really have a portable record right there at your fingertips.
Thank you, Jason Little, President and CEO of Baptist Memorial Hospital, for you being here and being our guest, and we really do look forward to working with you at Baptist.
Thank you.
How one woman CEO is helping children with a vision for the future that leads children to see.